Hello, my name's Jules Knight and I work in Imperial College Healthcare in central London. I'm a dementia clinical nurse specialist and I've worked in dementia for the last 20 years. Throughout my career, I've been very fortunate in that I've been able to use massage, in particular hand massage, with people with dementia, with supporting their carers in using hand massage and also working with staff on wards and in care settings using hand massage. Touch is an extremely important thing for people with dementia, particularly as communication can become difficult. Touch provides reassurance, it grounds people, and it also allows staff and carers to make a connection with someone who maybe struggles with using words. I've got with me Patricia. It's very lovely to have you here today. And what we're going to do is we're going to have a session on hand massage. I'm going to speak and explain the hand massage as I go through, and we're going to talk about why we choose hand massage and some of the reasons why you may or may not massage somebody. So the reason why we choose to do hand massage specifically is because generally our hands are the most easily accessible place for us to massage. It's usually socially acceptable to hold somebody's hand, and people don't tend to mind you holding their hand. We're thinking of people who are in hospital, who may be in care homes, or who may be needing that extra bit of care. So the hand is the most easiest place for us to get.
Yes.
And it's generally quite comfortable, isn't it?
It is, and of course the hand is the most sensitive on most people.
It is. So when you're massaging the hand, you're actually stimulating a lot of sensory organs in the skin,
Yes.
which is therefore stimulating the mind. You're very right, Patricia.
Yes.
There are sometimes reasons why we wouldn't look to massage somebody, but there's very few reasons why we wouldn't be able to massage somebody's hand. It's really a good idea to speak with the person themselves. We want to find out whether they're touchy-feely. Some people really enjoy having their hands held, being hugged, having massages, for example. But other people, and I always refer back to my friend, when she goes to the hairdressers and they do that lovely head massage, she always kind of freezes up and gets very stiff because she doesn't like to be touched in that way. She doesn't like her hands being held, and she certainly doesn't like me hugging her, and I'm a touchy-feely, huggy person. So it does make me laugh, but it's always important to ask the person.
Yes.
If they're not able to tell you, then always speak to the family, because the family will be able to let you know whether it's something they might enjoy. If the person isn't able to speak to you, if they're not able to verbally communicate, what I tend to do is, sorry Patricia, I'll just hold your hand. And if someone lets me hold their hand, after a few minutes, I'll gently begin to stroke their hand. And then if they tolerate that and they're happy with that, then I'll commence a hand massage. When you're thinking about a hand massage, there are, as I said, some reasons that may stop you from doing it, what we would call contraindications. So you ask the person whether they have any pain in their hand. So Patricia, is there any pain in your hand?
Yes, I have pain in my ring finger.
Okay. It's quite swollen, isn't it?
Yes, it has arthritis in it, and it's extremely painful.
Okay, this wouldn't prevent Patricia from having a massage, but what we need to be really careful is with arthritis is that we don't squeeze the joints or put pressure on the joints, but we can gently massage around the joints. And obviously when we're doing that, I'll ask you whether you're comfortable with that. And if you do feel any pain, then please let me know.
I will.
So other things that we want to think about, particularly in older people, is osteoporosis, and that's where the bones become more fragile and brittle and are more easily broken. And I think we spoke earlier, you don't have any problems with your bones.
I don't.
Again, it wouldn't stop you from massaging, but you just need to be much more gentle. And again, when we're looking at the skin on someone that we're massaging, we want to make sure that the skin's intact. As we get older, the skin does get frailer. It's more easily torn, it's more susceptible to cuts and dryness, for example. So we wouldn't want to massage over any areas that are cut or sore. We can massage around those areas, but we wouldn't want to massage directly over them. Sometimes people, particularly in hospital, have infections, And what I would suggest in those cases is to speak to the doctor, speak to the nurses, just to see whether a massage is applicable. And obviously sometimes people could have things like tumours or other diseases in their hands and arms, and again it would be advisable to speak to the doctor, or if someone's living at home then it would be the GP you'd want to speak to, just to clarify. But have a look at the hand. As I said, Patricia's got lovely skin. It's very soft, and when we turn it over we can have a look and see that she's got no cuts or abrasions on her hand. There's nothing that we would have to worry about. She's got a little bit of dry skin, but we're using a nice oil today, so your hands will be lovely and moisturised by the end of it. The oils that we use are pre-mixed massage oils. I would suggest that these are bought. You can use very simple oils, even things like almond oil. You can even use olive oil if you want to. Please be aware of any allergies that a person may have. If you are using nut oils, obviously you need to ask someone if they have a nut allergy. One very gentle oil that's also good to use is grapeseed oil. That's really, really soft. But you can use hand creams, you can use aqueous cream. Anything that the patient would generally use to moisturise their hands is absolutely fine. I tend to start by just holding somebody's hand, and that way you can help them calm down, relax and feel grounded for the up and coming massage. And also it gives you an opportunity to feel their hand, feel the warmth of their hand, and for you to relax as well. The whole process should be relaxing for you and also for the person receiving the massage. Gently cup your hands around their hand. Don't hold your hand like this. Massages aren't nice when your hand is stiff. You really need to relax your hand. So let your hand mould around theirs for a while. And sometimes there can be a temperature difference between your hands. My hands always tend to be a little bit cold, so I do sometimes wash them in hot water prior to touching somebody. But let the hands melt together and come to the same temperature. Once you've done that, you can start to use your oil or hand cream. And what I tend to do without losing contact is place my hand on top of their hand and then add the oil. Never put the oil directly onto the hand of the person you're massaging. The reason being it can often be quite cold and it can shock somebody. It can really startle them. So always warm the oil in your hands. So I'm just gently rubbing the oil around my hands. And if someone's happy to, I let them smell the oil.
Beautiful.
And it's lovely, isn't it? And this one is a relaxing oil, and it's a pre-mixed oil, so it's very, very safe for us to use. And again, I would hold and cup somebody's hand and begin by just gently warming their hand with some strokes. And this is really about getting the oil all over their hand and warming their hand up in the first instance. Now with the joy of hand massage, the thing is you can do this for 10 minutes, you can do it for 5 minutes, you can even do it for a minute or half an hour on each hand. It really is dependent on how much time you have and how much time you can spend with a person. And I'd always suggest that you do both hands as well. So if you've got 10 minutes, think about doing 5 minutes on each hand.
Yes.
And the reason we do each hand is because we want the person to feel nice and even on both sides of the body. So we warm the hand up with these gentle strokes. And then once the hand is warm and the oil is spread evenly, we then cup the hand underneath. So our fingers are in that shape and they're cupping Patricia's palm underneath, so it should feel quite comfortable.
Yes, it does.
Then we get our thumbs and we'll start on one side and we move gently up the back of the hand with our thumb, making little O's. And then we come down. And then we can start on this side with our thumbs, moving up, making little O's, and then come back down. Once you get the hang of that, you can use both thumbs at the same time and you can massage up the hand gently. And again, get to the wrist and come back down the outside, and then you can start again. Also, when you get to the wrist area, you can take your thumb around the wrist and around the bones and gently do the little O movements again with the thumb. And I'll show you on this side as well. You may need to move your hands underneath so that they continue to support the hand. And just take it gently. It's quite relaxing, isn't it?
Very soothing.
And it should be relaxing for both of you. It's almost like a time-out period, isn't it?
Yes, yes it is.
So when you've done that, you can then move down the hand and you can begin to look at the fingers and the thumb. So if we start with the thumb, we can gently squeeze the thumb at the sides. Again, be careful of the joints. Don't squeeze directly on the joints, so it's in between. And then at the side of the nail, and you can come off. And again, you can squeeze the top of the thumb and on the top of the nail and pull off. On the fingers, Patricia's got a tiny little cut there, so we won't massage over it, and squeeze the sides and squeeze the nail, side of the nail, and come off. So we won't squeeze that bit there, but we'll do this bit. Squeeze the nail on the pad of the finger and come off. And here. And come off. Now this is your sore finger, isn't it?
It is, yes.
So we won't squeeze here, but lower down. You can squeeze there and come off. Was that okay?
That's okay.
And again, on the little finger, and squeeze the pad and come off. And then we can turn the hand over and we can repeat that on this side with our thumbs. So we cup the hand underneath, and again make sure that the person's relaxed, that they're not uncomfortable. With our thumbs, we can start with on this side with our little O's, and we can work our way up. The palm side of the hand is actually a lot fleshier, and there's not so many bones you can feel on this side. It's nicely padded. So you can get your thumbs and you can actually have a little bit more pressure. And again, up to the wrist and come down. And then you can do the same on this side with this thumb. There we go, up to the wrist and come down. Again, you can use both thumbs, supporting underneath in that shape. You can move up the palm to the wrist and come down. And again, up the middle and come down. One of the things you might want to try is you can use your knuckles in here, which sounds a bit scary, but if you make your hands into a fist and you can then roll your knuckles a bit like this. It takes a little bit of practice to do that, but you can actually practice on yourself if you want to learn. And it's literally moving round the palm of the hand with your knuckles. And you can learn to do that on yourself, and then you can try it on a person with dementia. So we're going to try that on you, Patricia. And again, obviously, if anything hurts, let me know. But I've got her hand secured with mine, so it's nice and stable and feels secure.
Yes.
My thumb's over your wrist, actually, so that it stays extra stable. And we're going to try that movement in the palm of the hand. So we just wiggle our fingers round. Now, Patricia's got a little bit of stiffness here in her thumb.
Yes.
So we're not going to push that too hard.
I've got arthritis in that thumb.
Yeah. So we're just going to dig around the looser area, because this doesn't move, does it?
No.
So we'll dig around here, and hopefully that feels quite pleasant.
It does.
We hold lots of stress in here, lots of stress. So if you are able to massage this area, it can often feel very, very relaxing, very comforting. And actually it's really nice then to just hold someone's hand for a little bit.
Yes.
And
it does feel nice.
the heat of the hand is it's quite something, isn't it?
Yes.
When you've massaged, it feels very warm.
Yes, it does.
So we can come down the hand and then we can turn it back over. And all the time I'm keeping in contact with Patricia as much as possible so that you feel secure. And I'm going to work my way up your arm slightly, so I'm going to move you a little bit forward. That's it. And we're going to massage from the wrist to the elbow. And again, if anything's painful, let me know, but it shouldn't be. This area here is quite soft. And the elbow here, where we're going to massage around, is an area we tend to neglect.
Yes.
We can forget about putting moisture on there. Sometimes it gets a little bit dry, so it's always nice to do. So again, keeping your hand on, we're going to pop some oil in our hand, and again about 10 pence piece size, warm the oil. And have another sniff. It's lovely, isn't it?
Delightful.
So holding on to the back of the hand to steady the hand and keep it supported, we're going to move up the arm and work round the elbow and back down. So up towards the elbow and round and back down. You probably want to work on finding a comfortable position to do this in. Obviously we're filming today, so we want to hopefully give you the best angles and the best shots, but really find a way that you're comfortable massaging and that the person you're massaging is comfortable. So you can move up the arm and back down. Again, what you can do is you can use your thumb and you can do the little O's all the way up the arm. And I've secured Patricia's arm here, so it doesn't go anywhere. And you can massage those muscles. And again, it probably feels very nice.
It does.
That's good to hear.
The whole thing is very nice.
And we can also work our way up with our hands on this side. Again, I'm supporting your wrist and I'm going to work my way up with my thumb. And come back down. If you want to do slightly deeper pressure, we can use our arms to do a bit of massaging. So I'm just going to put some oil on my arm. I'm going to hold your hand again, and I'm going to work my way up your arm to your elbow, and I'm going to come back down with my hand. And that can be a very smooth movement.
Yes.
So I'm going up and pulling back and coming down with my hand. Now, you need to be careful because, again, we have a joint here. We don't want pressure on this joint because it's going to be very sore for Patricia. So as I work up, I stop just before the elbow and come back down with my hand. When you're coming towards the end of a massage, what you probably want to think about is how you're going to make someone's hand comfortable. And how I tend to end is by holding someone's hand and gently stroking down their arm. And initially the strokes are quite strong and they're very firm. And then gradually I make them lighter and lighter. Always make sure you go from the elbow all the way down to the ends of the fingertips, gradually getting lighter. You almost reach the point where you're tickling someone, but not quite. And in that way the person knows that the massage is coming to an end. So I keep hold of the hand, and with the towel I have, I gently wrap the person's hand in the towel and remove my hand from underneath. You don't have to be too neat with this, there's no special way of doing it. It's literally just to keep the heat in the hand, wrap it up, keep it warm. Hold your hands on top of the towel for a short while and then take your hands away. And at that time, you can start massaging the second hand if you haven't done so already. Or you'll have two hands that are nicely wrapped in towels. And at that time, if you're able to, you can ask the person how the massage is. It may be that you're looking at someone who's asleep or someone who's not able to kind of verbally explain to you how the massage is. But with Patricia, obviously, you can tell us, how was the massage?
The massage was really, really very, very comforting. My arm feels so relaxed, I can hardly feel that I've got an arm now or a hand, and usually my hand is very heavy and very painful, but now it feels as if it's so light that it isn't there.
That's lovely to hear. I was teaching a ward staff how to hand massage many years ago, and I had some practical lessons with the ward staff, and I suggested that we go out onto the ward and work with some of the patients. And the ward was for people with dementia who were at the very end stage of their dementia, reaching kind of palliative care. And I worked with a particular lady who was non-verbal, and the staff actually said to me, "You probably don't want to work with her, she's not able to speak anymore." So I sat down with her, took her hand, held her hand and stroked it, and she seemed very happy for me to do that. And then I worked with her hand and her arm for about 10 minutes, gently stroking with a little bit of oil. And I wrapped her hand up like this, and she grabbed my hand and she put my hand back on her hand when I lifted my hand off. And I said to her, "I'm going to come and do your other hand. I'm going to massage your other hand for you." And I went round and I massaged her other hand. And at the end of the process, she was in her chair with both hands wrapped in a white fluffy towel, similar to this. And she opened her eyes and she gave me the biggest smile.
Oh,
And she said, "Thank you."
how lovely.
And this was a lady who I'd been told hadn't spoken for at least a couple of years, and it was just heartwarming. It was absolutely
That
lovely.
shows you how relaxed she was and able to speak.
Yeah.
And I must also say thank you, Jules.
Oh,
It was very, very nice.
thank you. Thank you for coming in today.